SFU Health Sciences because of my interest in working with vulnerable people. And this interest is developed through my work with the Red Cross, which is an organization that works to improve the lives of vulnerable people, both in Canada and around the world. And through that work, I learned that health and vulnerability are very, very closely linked. So I wanted to come to SFU and learn about the skills and knowledge in order to better equip myself to working with vulnerable populations. One example of how health and vulnerability are so closely linked is one that we see in the clinic, unfortunately too often, and that's where a young mother who's about 30 to 40 years old comes to the clinic to see you, the family doctor, because of terrible leg pain that's been bothering her. And she has these terrible pain because of her diabetes. And she has diabetes because, unfortunately, she hasn't had the best diet for a long time. She's a single mom, 2 kids, and she works 2 jobs, one at a big box store and another at a fast food chain. And because she doesn't have time to make food at home, after working these 2 jobs, she often just brings home the fast food. And unfortunately, this building up through the decades has gotten her diabetes. And one might ask, so why is she in this difficult situation, being, not eating healthy, working these entry-level jobs, and ending up in a terrible health condition? And that may be because she never finished high school. And she didn't finish high school because she had to run away from home. And she ran away from home because she was abused at home. And so when we see someone like that at the clinic who ends up with terrible leg pain, that is barely even the tip of the iceberg of someone's story. And now if we reflect on that story a little bit, we can see that so much could have been done at various levels to interrupt the cycle of vulnerability and disease. For example, at the clinic, maybe the doctor could have worked more earlier to help promote a better diet, or to help her better manage her diabetes. Or maybe that the city that she lives in could have had more programs where she could exercise. That makes it easier for busy people to exercise, or have bike lanes available so people can bike to work. Maybe there could have been better mental health services to help people move past the difficult situation that may have brought on some mental health concerns. And even some things that we see, some things that we can think of are beyond the immediate health realm and move into the determinants of health. Like, for example, maybe there could have been better programs at the university to help people who are struggling financially to gain access to education, or even financial support so that she can better care for herself. I think what we can take from this is that health is key to determining where people can go with their lives. With good health, people can achieve their potential much more effectively, and even if they started out at a very difficult place, they can really work to alleviate their own vulnerability. But with poor health, not only are people limited in terms of their potential, it also exacerbates the situation that they may have started. I think right now is a very exciting time to learn about health sciences because of the new challenges that are facing Canada and the world right now. For example, with the Canadian healthcare system right now, there is a huge drive to make the system more efficient, cost less, but at the same time to make sure that the people who need it the most are still able to access and benefit from the system. With climate change, various infectious diseases are moving into places that they never were before and creating new challenges as they begin to appear. With HIV/AIDS, right now there's many exciting research going on about treatment as prevention and looking for new drugs, looking for new ways to fight this virus. And many other neglected diseases. Laws are being put into place in Canada and around the world that might make it more difficult for people who have low socioeconomic status to access the medication that they need to treat their illnesses. And lastly, a new phenomenon that are beginning to be noticed is where healthcare workers around the world working in areas of armed conflict are being increasingly targeted as part of a strategy of war. And this is creating a massive ripple effect. For example, where polio is, the vaccination campaign for polio is being hindered. And out of the 4 countries that are currently affected by polio, 2 are these are topics that you can explore through health sciences and gain more skills and knowledge to help better equip yourself to take actions on these issues. Health sciences takes you through a cell to society approach where you look at an issue from a molecular level, like for example HIV, taking a look at the virus and what it does on the cellular level. But then you also explore how that fits into the organ system, how that fits into the person, and what the experience of this person might be like, and how our health system as a whole, or even globally, is being affected by this issue. And so through this you get quite a holistic approach and more comprehensive look and perspective on many issues around health. And through the program you can learn about things like epidemiology, the molecular sciences, policy, ethics, and all these topics that can even be complemented by co-op, which I think will really help provide each student with a very good set of perspectives and tools in order to play a real leadership role in health and in society in the coming years. Going through medical school right now, I'm finding health sciences to be one of the best tools that I have in working with people. It provides me with context, especially when working with patients right in front of me. It helps me view that interaction and that encounter from the perspective of the patient, and also possibly from the perspective of society in general. It also helps me fit and contextualize the issues surrounding the patient that's right in front of me and the challenges that they face into any larger patterns that may affect society in general. And finally, I think it inspires me to balance my future career between taking care of the patient that's right in front of me with working on some of the root causes that affect the health of people in general. I gave the example earlier on how health sciences has helped me prepare for work in medicine. I think that there are many other ways that health sciences open doors to help people make a positive difference in the health of the population. I would encourage people to find something that they're passionate about in health sciences and be that next change maker that will help make a positive difference in people's lives and in their health.